Good afternoon, and thank you for joining the daily briefing on the City of Philadelphia's response to COVID-19. Today, all speakers are joining the briefing virtually to adhere to social distancing guidelines. We will begin our briefing with opening remarks from Mayor Jim Kenney. Mayor, you now have the floor.
Thank you very much, and good afternoon to everyone. Yesterday, the PHL COVID-19 Fund announced its third round of grants, awarding another $2.5 million to 72 additional nonprofit organizations serving on the front lines of the coronavirus crisis. To date, the fund has granted a total of $7.3 million to 195 nonprofit organizations in our region. They have prioritized organizations that serve our neighbors hardest hit by the coronavirus crisis. Thank you to the Delaware Valley Regional Economic Development Fund, the Rite Aid Foundation, the Joe and Marie Field Foundation, John Powers Middleton, and the Hearst Foundations for your generous donations to the fund this week. These contributions, along with the 4,000 of you who have gone online and donated at phlcovid19fund.org. That's phlcovid19fund.org, have helped us raise more than $15 million for our neighbors in need. Thank you to all of you, and let's keep going in the right direction. As many of you know, we are also working to get Chromebooks to every child enrolled in a Philadelphia School District school to continue learning virtually. This week, the Independence Public Media Foundation contributed $100,000 towards this effort. Thank you for helping us to get our kids the tools they need to learn. We also want to thank Tito's Vodka. Yesterday, they delivered 4 55-gallon drums and over 2,000 bottles of hand sanitizer, plus 1,500 masks and gloves to our Emergency Operations Center. And finally, a huge thank you to the FIFAS North America, with support from Holt Logistics for donating 10,000 pounds of fresh fruit each week to aid the city's food access efforts. In the midst of the COVID-19 pandemic, Philadelphia has received some good news. The Philadelphia Housing Authority has won a $30 million Choice Neighborhoods Initiative implementation grant for the Charswood Transformation Plan. The money will be used to leverage more financing as the authority rebuilds and invigorates the Charswood-Blumberg neighborhood. We want to thank HUD and all of our partners for choosing Philadelphia and investing in Charswood. In light of the pandemic and the economic challenges we're sure to face in the months ahead, providing more affordable housing will be more critical than ever. We must build and preserve homes, amenities, and services for those in need, and make certain that diverse communities and low-income residents benefit from neighborhood development. We are thrilled that we will be able to realize these goals through the Charswood-Blumberg Transformation Plan. There's also a bit more good news coming out of Washington with the passage of the latest spending package, which provides more money for the Paycheck Prevention Program, hospitals, and for testing. We're particularly pleased that a portion of the PPP funding will be set aside for businesses that do not have established banking relationships, including many minority-owned businesses. We are excited to share that we've been working with Goldman Sachs and Lendistry.com on a partnership that will help provide several $1 million in potentially forgivable SBA Paycheck Protection Program loans to small businesses in our area. We'll have more details to share later today once the president signs the bill into law. We don't yet have all the details of how much of this new funding will come to Philadelphia, but all additional resources are critical at this juncture. And while we're grateful that the latest package passed, it's another reminder that many pressing issues still exist that must be addressed. As I've said before, governments are in desperate need of direct and flexible aid to help with revenue losses that have resulted from the economic disruption. Without it, cities, counties, and states across the country will be facing a total of hundreds of billions in deficits, and the hard choices that will be required will certainly not help with economic recovery. Cities and states are on the front line fighting COVID-19. And they shouldn't have to sacrifice vital services their residents need of ideological differences at the federal level. And before I turn it over to Dr. Farley, I also wanted to share that the Department of Revenue has pushed back the 2020 real estate tax due date to June 15th, 2020. That's June 15th, 2020. Similarly, the department has extended the deadline to apply for an installment payment plan for 2020 real estate taxes. All senior citizens over the age of 65 and eligible low-income homeowners can apply for this installment plan by June 15th. More information is available on Revenue's website phila.gov/revenue. That's phila.gov/revenue. Now I ask Dr. Farley to come in with his daily update.
Good afternoon. The situation with the epidemic today is similar to where we've been over the last few days. There have been 651 new cases diagnosed in Philadelphia residents since yesterday, bringing us to a total of 11,877 since the beginning of the epidemic. Now, if you follow this, you see that our data arrives in batches, and it's often delayed from when the time the laboratory actually tests the report. So we want to get a sense of the trends. It's better for you to look at the graph on the website. And if you look at that, you see that this is about the average number of cases that we've seen in the last week or so, maybe slightly down. I was on the street yesterday and someone stopped and asked me if we were past the peak of the epidemic. And I have to say, I'm not willing to say that we're past the peak yet. Things are looking a little bit better, but this virus may yet surprise us. We're continuing to address clusters of this infection in a variety of congregate settings where people live together, including the city's jail. Right now, we have 62 inmates who are testing positive. That includes 9 new positives since yesterday, but then 6 others who have recovered and been removed from isolation. Today I can report we have 6 new deaths from the coronavirus infection since this time yesterday, bringing us to a total of 449. Of those 236, or 53%, were in nursing home residents. That lower number, that 6 is a lower number today than we've been seeing in the past. There is some delays in reporting of deaths, as there are delays in reporting of cases. If you look at the graph on our website, though, it looks like it may be showing a decline in the daily number of deaths. If that continues, that would certainly be a very welcome trend. As far as our situation in hospitals, this morning we have 1,013 coronavirus inpatients in Philadelphia hospitals, 1,881 in hospitals in the Southeast Pennsylvania region. Those numbers are both an increase from yesterday. Still, 31% of the general hospital beds in the city are available, and 27% of the intensive care unit beds are available. And so those hospitals that are under strain continue to transfer patients to other hospitals that have vacancies that manage the issue. The Leah Core Center is still operating and has a very small number of patients, and it's available if more patients were to need it. Now, on testing, we are still limited by the number of swabs we have to collect samples, by the laboratory capacity to run those tests, and the delays in reporting. We still have our criteria. We're recommending testing only for people who are healthcare workers or people over the age of 50 who have symptoms that are typical of the coronavirus. Testing is available for people who meet those symptoms or meet those criteria. Just go to our website, phila.gov/COVID, and you can see links and phone numbers about all the different sites you can go. Now, as of today, you should see new sites listed on that website because we've been working, as we discussed yesterday, to increase accessibility of testing, particularly in low-income, disadvantaged populations. So there should be 10 new federally qualified health center sites listed on the website as of today, with phone numbers to call for scheduling. And they are asking that people call ahead so that they know that they're coming, so that the facility can use the proper protective equipment when they're testing people. Some of those new sites will be operating today. Some of them will start next week. And we're working with other federally qualified health centers, and we hope to announce other sites next week. Overall, I would say our level of case count means that we are continuing to make progress. This is not the increases that we saw early on in the epidemic, but still with hundreds of cases being diagnosed every day, we're still in the thick of this. And so our best approach right now, with the limited testing, but the widespread spread of the virus, is to just assume that everyone around you has the infection, just to be on the safe side. So stay home, keep your distance from people if you have to go out of the home, and wear a mask. And again, information, all sorts of information on this is on our website, www.phila.gov/COVID, or if you have medical questions, 1-800-722-7112. Thanks.
Thank you, Dr. Farley. We are now going to turn it over to Armando, who will give us a summary of both the mayor's remarks and Dr. Farley's remarks in Spanish. Thank you.
Mensaje del alcalde Jim Kenney para el viernes 24 de abril del 2020. Buenas tardes a todos. Ayer, el Fondo PHLB COVID-19 anunció su tercera ronda de subvenciones, otorgando otros $2,5 millones a 72 organizaciones sin fines de lucro que están al frente de esta crisis sanitaria. Hasta la fecha, el fondo ha otorgado un total de $7,300,000 a 195 organizaciones sin fines de lucro en nuestra región. Se ha dado prioridad a las organizaciones que sirven a nuestros vecinos más necesitados por la crisis del coronavirus. Gracias al Delaware Valley Regional Economic Development Fund, a la Rite Aid Foundation, a la Joan Marie Field Foundation, a John Powers Middleton y la Hearst Foundations por sus generosas donaciones esta semana. Estas contribuciones, junto a las de más de 4,000 personas que han donado al Covid-19fund.org, nos han ayudado a recaudar más de $15 millones para nuestras comunidades más necesitadas. Gracias a todos y sigamos adelante. Como muchos de ustedes saben, también estamos trabajando para que cada niño matriculado en una escuela del Distrito Escolar de Filadelfia obtenga una computadora portátil Chromebook para continuar aprendiendo virtualmente. Esta semana, Independence Public Media Foundation contribuyó con $100,000 para este esfuerzo. Gracias por ayudarnos a darles a nuestros niños las herramientas que necesitan para aprender. También queremos agradecer a Tito's Vodka. Ayer entregaron 4 bidones de 55 galones y más de 2,000 botellas de desinfectante para manos, más de 1,500 máscaras y guantes para nuestro centro de operaciones de emergencia. Y finalmente, un enorme agradecimiento a Fives Norteamérica, que con el apoyo de Whole Logistics, por haber donado 10,000 libras de fruta fresca cada semana para ayudar a la iniciativa de acceso a los alimentos de la ciudad. En medio de la pandemia del COVID-19, Filadelfia también ha recibido buenas noticias. La Autoridad de Vivienda de Filadelfia ha ganado una subvención de $30 millones del Choice Neighborhoods Initiative para la implementación del Chartwoods Transformation Plan. Queremos agradecer a HUD y a todos nuestros socios por elegir a Filadelfia y por invertir en Charswood. A luz de la pandemia y los desafíos económicos que seguramente enfrentaremos en los próximos meses, el proporcionar viviendas más asequibles será más crítico que nunca. Debemos construir y preservar viviendas, disponer de servicios para los necesitados y asegurarnos de que las comunidades y residentes de bajos ingresos se beneficien del desarrollo de los vecindarios. También tenemos algunas buenas noticias que vienen de Washington con la aprobación del último paquete de gastos que proporciona más dinero para el programa de protección de cheques de pago, hospitales y pruebas. Nos complace especialmente que una parte de los fondos del programa de protección de cheques de pago se destinará a empresas que no tienen relaciones bancarias preestablecidas, incluyendo muchos negocios que son propiedad de minorías. Nos complace compartir que hemos estado trabajando con Goldman Sachs y Lendistry.com en una asociación que ayudará a proporcionar varios millones de dólares en préstamos del programa de protección de la SBA, la Agencia para los Pequeños Negocios, que potencialmente beneficia a pequeñas empresas en nuestra área. Tendremos más detalles para compartir una vez que el presidente haya firmado la ley. Y todavía no tenemos los detalles de cuánto de estos fondos llegarán a Filadelfia, pero todos los recursos adicionales son críticos en este momento. Y aunque estemos agradecidos de que se haya aprobado este último paquete, este es otro recordatorio de que aún existen muchos problemas urgentes que deben enfrentarse. Como he dicho antes, los gobiernos necesitan desesperadamente ayuda directa y flexible para ayudar con las pérdidas de los ingresos resultantes de la interrupción económica. Sin ella, las ciudades, los condados y los estados de todo el país enfrentarán cientos de miles de millones de dólares en déficits, y las decisiones difíciles que se tiendan a tomar ciertamente no ayudarán con la recuperación económica. Las ciudades y los estados están en la primera línea de lucha contra el COVID-19 y no deberían tener que sacrificar los servicios vitales para sus residentes por diferencias ideológicas a nivel federal. Antes de comenzar la actualización en materia de salud, también quería compartir que el Department of Revenue, o el Departamento de Recaudación Fiscal, ha retrasado la fecha del vencimiento del impuesto de bienes raíces del año 2020 al 15 de junio del 2020. Del mismo modo, el departamento ha extendido el plazo para solicitar un plan de pago fraccionado para el impuesto inmobiliario del año 2020. Todos los ciudadanos mayores de 65 años y los propietarios de bajos ingresos elegibles pueden solicitar este plan de cuotas antes del 15 de junio. Hay más información disponible en el sitio web fila.gov/revenue. Y esta es la actualización en materia de salud al viernes 20 de abril del 2020. Desde ayer se han confirmado 651 nuevos casos de coronavirus en Filadelfia y actualmente tenemos un total de 11,877 casos en la ciudad. Los datos nos llegan en lotes y a veces vienen retrasados, pero por lo general seguimos dentro del promedio diario de casos de la semana pasada o quizás un poco más bajo. Tenemos 9 casos positivos del COVID-19 entre los internos, con un total de 62 casos registrados y 6 internos que ya se han recuperado satisfactoriamente. Tristemente, reportamos también 6 nuevos fallecimientos en Filadelfia. Un total de 449 personas han muerto por la COVID-19. 236 de ellos, o el 53%, han sido muertes en hogares de ancianos, porque este virus no discrimina por raza o género. Nuestros hospitales continúan monitoreando el crecimiento y el aumento de los casos. 1.013 personas han sido hospitalizadas en Filadelfia y 1.881 personas han sido hospitalizadas en la región sureste de Pensilvania. En comparación con los datos obtenidos el día de ayer, se nota un aumento en el número de pacientes hospitalizados. 31% de las camas de los hospitales y el 27% de las unidades de cuidado intensivo todavía están disponibles en la región. El Yakure Center está operando y está atendiendo a un número pequeño de pacientes. Continuamos con las limitaciones en el número de pruebas disponibles debido a la escasez de los hisopos para recolectar muestras y a la capacidad de procesamiento que tienen los laboratorios. Se recomienda que las pruebas se les den a las personas mayores de 50 años y aquellas que presenten síntomas. Usted puede encontrar mayor información sobre los centros de pruebas localmente en fila.gov/COVID-19 bajo la pestaña FAQ. Estamos trabajando con los centros de salud federal calificados para ampliar el acceso a las pruebas a las poblaciones y vecindarios desfavorecidos. Hay 10 centros de salud federalmente calificados que están administrando pruebas ubicados en muchos vecindarios en Filadelfia. Las personas deben llamar y hacer una cita previamente. La información se encuentra disponible en el fila.gov/COVID-19 pestaña FAQ. Algunos de estos centros están operativos el día de hoy, otros la próxima semana. Todo indica que hay un aumento muy lento. Sin embargo, todavía hay muchos casos. La mejor recomendación en este momento para prevenir la propagación del virus es mantener la distancia social, porque el virus sigue circulando en nuestro ambiente. Si debe salir a trabajar o al supermercado, le recomendamos mantener una distancia social de 6 pies, usar máscaras de tela en lugares públicos donde sea difícil mantener las medidas de distanciamiento social, lavarse las manos apenas llegue a casa, y le invitamos a consultar el sitio web para mayor información, www.fila.gov/COVID-19. Recuerde usted que puede llamar al 311 si tiene preguntas sobre el COVID-19. Hay servicios de traducción disponible en 100 idiomas. Y si tiene preguntas de carácter médico, puede llamar las 24 horas, 7 días por semana al 1-800-722-7112. Y esta llamada es gratuita. Gracias.
Thank you, Armando. We will now move to our Q&A portion for members of the media. And please remember, we do have limited time during these briefings, so only one representative from each outlet is permitted to ask questions. Reporters are asked to limit their questions to 3 or fewer, and we will do a second round of questions if time permits. For those logged in today, please use the raise your hand feature. It can be found under the participants list. We also ask that you use video to ask your question if you are able for broadcasting purposes. We will unmute you one by one to answer your questions. And today we will start with Denise Clay of the Philadelphia Sunday Sun. Denise?
Good afternoon, everyone. My question regards FEMA and its and grants that we're getting or have access to from them regarding recovery. Is there any plan for the city to apply for FEMA grants regarding homelessness? I understand there are some available for the city to apply for.
Ryan, you want to take a run at that?
Sure. I mean, I think the short answer is yes. We're going to apply for every FEMA grant that's available. And I believe we've actually received some from the first round of grant dollars as well. Whether it's regarding around homelessness, around reimbursement, around, we are going to seek aggressively every dollar that we can find.
Has the city gotten any money from the PPP first round? And I guess where did that go?
So Denise, I actually want to clarify something.
Okay, cool.
On the homeless grants, those are not actually from FEMA per se. They're actually, there are a number of federal programs. FEMA is probably the last resort. And so it is really a host of different federal programs, some run by HUD, some run by CSBG. So there's dollars in Treasury. So there's a gamut of federal funding available, not just FEMA. So I just want to make that very clear. And then around PPP, I don't think we have those numbers. Those were being handled by banks themselves.
Okay, thank you.
Thank you, Denise. Next, we are going to go to Yaima Crespo with Telemundo. Yaima?
Sí, esa es mi pregunta para Farley, es sobre los centros de prueba. Ayer se dijo que la prueba no tiene costo y se le va a pasar el costo al seguro médico, pero ¿qué pasa con las personas que no tienen seguro y aquellas que son indocumentadas?
This is a question for Commissioner Farley in regards to the testing centers available. You've already mentioned that there will be no cost for the testing and that there would be reimbursement through medical insurance. But what happens to those that do not have medical insurance and those that are undocumented?
Same thing. That's covered. If they go to federally qualified health centers, they're already handle people who have no health insurance. They have ways of covering that. And the other sites, it's my understanding that the other sites, even run by hospitals, they'll test everybody regardless of whether they have health insurance, and they don't check for documentation status.
La respuesta es la misma. Las personas que están acudiendo a los centros que son calificados federalmente pueden hacerlo sin seguro médico. Y con respecto a los otros sitios, en los hospitales, no se están haciendo preguntas sobre respecto al seguro o a su elegibilidad por documentación.
En términos del centro de pruebas que se va a abrir en Kensington, ¿hay alguna información exactamente dónde va a ser, cómo se va a capacitar ese centro de pruebas?
In regards to the testing site that's to be open in Kensington, is there any information as to how that's going to be set up for the testing?
We don't have that information today. We hope to have that information for you early next week.
No contamos con esa información al día de hoy, pero esperamos poder tener esa información para la próxima semana.
Y esta pregunta es para el alcalde, si tiene alguna actualización sobre los servicios que tendrían que cortar si no reciben esa subvención federal para ayudar a la ciudad en su crisis económica.
And this is a question for the mayor. Is there any update on the services that might have to be cut if there is no grants received from the federal government?
Well, that's a rolling conversation. We're going to take our first blush at a revised budget on May 1st. The longer the shutdown of business and the economy, the worse the situation is going to get. So we're going to apply for everything we can apply for under the sun from the federal government and the state government. But the longer that we're shut down in the business community, the worse the revenue will be, and the more difficult it's going to be to provide full length of services. So that's why we have to remain disciplined. We have to socially distance. We have to wear masks. We cannot gather in groups, because the longer we do that, the longer it's going to take for us to get the economy back rolling again, and the worse the service issue is going to be when it comes to the city. So we all need to be disciplined and mature about this and move forward under the advice of what the doctors are telling us.
Sí, esta es una conversación continua que estamos teniendo todavía. Nosotros vamos a empezar a conversar sobre la revisión del presupuesto el día 1 de mayo y obviamente mientras se cierran los negocios y más demora eso, obviamente eso va a afectar nuestra economía. Nosotros vamos a solicitar todos los fondos que podamos obtener, tanto a nivel federal como a nivel estatal, pero obviamente mientras continúa este cierre de la economía, nuestros ingresos van a decaer. Y obviamente lo que le pedimos a la gente mientras tanto es que ejerciten madurez y disciplina, manteniendo la distancia social, utilizando las máscaras, no congregándose en grupos, porque esto es un esfuerzo continuo. Nosotros vamos a tratar de hacer lo posible para tratar de mantener los servicios esenciales y básicos para nuestros ciudadanos, pero les pedimos en este momento disciplina, madurez y observar las indicaciones de los expertos médicos.
Muchas gracias, es todo.
Thank you very much.
Thank you. We are going to go to Sean Walsh of the Inquirer now. Sean?
Thanks. First question, is about the Governor Wolf's announcement regarding construction sites reopening. He also mentioned that local governments can impose stricter safety guidelines for sites if they choose. Is Philadelphia going to do this? And will the city allow construction to restart and continue on May 1st?
Doctor?
And Tom, unless you want to take it out, I'll
go ahead. Go ahead, Brian.
So we're reviewing the governor's directions. We have a group meeting internally to understand those directions, understand how what enforcement could look like, what staff we would need to operationalize construction going forward. So it'd be L&I permit review, streets department for lane closures and permit review, things like that. So we should have more information for you next week, but we're certainly under consideration, and we'll be able to give you more details on probably Monday or Tuesday.
And there will have to be on-site protocols when it comes to distancing and comes to hand washing, mask wearing. It really is going to be a list of things that a construction company and the workers would have to do in order to be safe.
Thanks. And then the next question is about SEPTA. So where do discussions stand between the administration and the union and SEPTA? What can riders and workers expect come Monday morning?
Well, hopefully riders and workers can expect to get on the bus they usually get on, the subway they usually get on. We're still in conversation now. Conversation's ongoing. It'll probably go through the weekend. Hopefully we can resolve it earlier than Saturday or Sunday, but we're at it, and we're trying to get it resolved.
Gotcha. And lastly, on nursing homes, in the past, I think you guys have mentioned that you're monitoring nursing homes and that if you would help with staffing if one was overrun. Have you guys had to do that with any facilities, or have you taken any other steps if there has been a nursing home that has gotten to a point where it needs help?
We have offered staffing from our Medical Reserve Corps to at least one nursing home. I'm not sure how many, and I'm not sure if the staff have actually worked in the nursing homes yet, but we definitely are engaged in those conversations. I'm sorry, what was the second half of your question?
Are there any other steps the city has taken to sort of help or intervene with ones that need help?
The main thing that we can do is really provide consultation and understanding what are the techniques that they're using which might inadvertently allow transmission to occur and how we can try to prevent that. We don't have the ability with the large number of nursing homes to be putting staff in there. So it's our expert advices that we think is the best resources. We do have experts here, and we have other people that have been trained by our experts who are in consultation with each nursing home.
Is there a theme that you've noticed from what you just said about things they could do differently to slow transmission or stop transmission? Is there something that some nursing homes anyway, are not doing or could be doing?
I don't think there's anything as far as the general principles that any nursing home is not trying to follow. The difficulty is getting every employee to do it under every circumstance. It's easy to slip up and touch your mask when you shouldn't, or not change something when you should, or if you take off some equipment, take it off in the wrong way, and sort of how to maintain the training when the personnel may be changing over, so that everybody's really following the technique meticulously 100% of the time.
And what was the facility that was offered help from the Reserve Corps?
The Philadelphia Nursing Home.
Oh, okay. Thank you.
Okay. Thank you, Sean. We're going to go to Martin Pratt of Philly YBN. Martin?
Yes, thank you for doing this, as always. The Philadelphia Citizen ran a story today, and I was wanted to get either the mayor or Brian's comment on this. The students that have laptops that can't afford internet, what's going to be done with them as far as you understand? And is there any pressure being brought to bear with Comcast providing internet access to these young people's homes?
Comcast has been very active over the years in providing internet access to people who can't afford it. We're working with the school district to identify the children whose homes do not have it and to try to make sure they do get it. We're still raising money for Chromebooks to make sure that everyone has it. If there's anyone out there that would like to make a contribution to the Chromebook effort, that would be great. And our goal is to get every child with a Chromebook and with internet.
Thank you. Just to add on to the mayor's comments. So we recognize that there's been some challenges around hotspots. So we are OITs working with the school district, a number of other agencies, as well as Verizon and Comcast to try and correct those issues. So it's definitely something we recognize, working very hard to correct.
Thank you. That's it.
Great. Thank you, Martin. We'll now go to Kennedy Rose with the Philadelphia Business Journal. Kennedy.
Hi, thanks so much for taking the time. I was wondering, what is the latest date the city and partners will decide whether Welcome America will happen?
We're having those discussions now. We'll have an announcement soon. It's really coming up close in time, and we have to make decisions in order to do an outdoor concert and celebration in front of Independence Hall. We have to make those arrangements in advance, so we're not ready to say yet, but it's getting a little too close based on the condition of our new cases and fatalities. So we'll have something for probably next week.
Okay. And I was wondering, when should we expect to hear more details about this partnership with Goldman Sachs and Lendistry? I'm
going to have to get back to you with that. I know that the loans are going to be used for payroll cost, interest on mortgages, rent, utilities, the whole gamut. But the details of it is being administered by Goldman Sachs. So we'll get back to you hopefully next week.
Fantastic. Thanks so much. That's all I had.
Thanks, Kennedy. It's my understanding that there will be a press release on that later today, but we'll keep you posted. Next, we'll go to Natasha Brown of CBS 3. Natasha.
Hi, good afternoon, everyone. Just a couple questions for Dr. Farley at this point. Dr. Farley, I know that you said that we do seem to be leveling off, at least in terms of cases, and that we are certainly have not reached our peak yet. So maybe you can help us understand, what would a peak look like in terms of the number of cases, or how will we know that that's where we are?
Yeah, unfortunately, you don't know whether you passed the peak until you're past it, and you can look back and say, okay, the numbers of cases we're seeing now are lower than they were a week ago or 2 weeks ago. The highest numbers we have on our website are in the range of 550 cases per day. And so, today we got data on 650 new cases. Now, those cases were reported on different days, and so that didn't put any daily peak on our graph more than 550 or so. But when we can go back and say, okay, we're consistently hitting below that 550 peak, we can say we're below it. And then we'll hope that the graph will continue to go down from there.
All right. And one other question for you, Dr. Farley, just for a moment here. On Thursday, President Trump appeared to recommend drinking disinfectant and light therapy as treatments for COVID-19. So as a medical professional, what is your response to that ultimately? And what would you say to those who are listening to that kind of advice?
I would just say I would strongly recommend for medical advice, people turn to doctors and not listen to the White House.
Thank you so much. That's all I have.
By the way, just for information's sake, internet providers have offered free or low cost options. You can get on the information on that at phila.gov.
Okay, thank you.
Thank you, Natasha. We're going to go to Argenis Figueroa with Univision.
Hola, buenas tardes. Mi pregunta es directamente para el alcalde y es sobre su reacción y si está de acuerdo con las recientes declaraciones del gobernador Wolf acerca de que Filadelfia podría ser el último área en reabrir su economía.
Hello?
Armando, I think you need to just unmute yourself.
Sorry, this question is for the mayor, and this is about your reaction and whether you agree or not with the statement by Governor Wolf that Philadelphia would be the last region to open up.
I think it's pretty self-evident because of the density of our population. There are counties in Pennsylvania that have more deer than they have population, and those are less impacted by the virus to date. Doesn't say that they won't be more impacted later on. But as you get further east and south, the concentration of population grows. We live closely together. The surrounding counties are very dense also. So, and again, I will reiterate what Dr. Farley and other doctors have been telling us all along. Be disciplined, socially distance, wear your masks, don't get into groups of people playing basketball or hanging out at the park. Just do the disciplined adult things we all need to do, and the faster we'll get to the point where the economy can open back up again.
Obviamente esto es algo que es autoevidente porque tenemos una mayor densidad poblacional y también hay que tomar en cuenta que en las regiones al oeste del estado hay más siervos que residentes en total y obviamente la tasa de infección puede llegar a ellos más adelante. En las regiones del este y del sur del estado obviamente hay mayor crecimiento en la población, hay mayor densidad poblacional, hay más gente que vive junta, congregada en los condados. Por el momento lo que pido es observar las indicaciones del Dr. Farley, ejercer la disciplina como ciudadanos, mantener la distancia social, usar las máscaras cuando sea necesario salir al público, entre el público, no congregarse en grupos si se va a jugar basquetbol o se va a ir a las canchas de deporte y mientras más se observen estas medidas, más rápido va a ser nuestro levantamiento de las medidas de urgencia y para poder recuperarnos económicamente más rápidamente.
Ok, muchas gracias. Es todo.
Thank you very much. That's all.
Thank you. We're going to go to Jason Peters now with Philly Weekly. Jason?
Hello. Thank you. My first question is about the tests and the difficulty getting the tests. What is the specific issue? Is it a cost issue or is it more of a production issue?
It's a production issue, and it's production of a few things. There are the swabs that you use to collect the tests that you stick in someone's nose and get the sample. Those are very specialized swabs. You can't use a Q-tip. It's something that has very specialized material. It doesn't have any DNA in it. Then there's also the chemicals that are used in the laboratory to run the samples. And there's also the machines that use those chemicals to run the samples. Now, there are maybe 6 or 7 different companies out there that have produced tests that can to do this. They make the machines, they make the chemicals, but there's only so many machines and chemicals they can produce at a time, and the entire country wants those. And so this really is a supply issue.
Okay, thank you. And then the other questions are about the 62 positive cases in Philadelphia prisons. Are those positive cases all held to the CDC guidelines for being tested?
So I think you're referring to the 62 inmates who are currently in isolation at the prison?
Yes.
Okay, so yes. So all of those individuals are currently in an isolation and are being cared for by medical professionals according to CDC guidelines.
So that are they all symptomatic and above 50 years old?
So let me jump in on that and say that our standard for who we are testing in the community is a different standard for who we test in a congregate setting like a jail. And so they're doing much more extensive testing in the city's jail than we would be in the community.
Oh, okay. Could you expand on what the difference is, or is that over?
In the jail, anybody who has symptoms right now is going to be tested regardless of their age. It's not just people over the age of 50. And there may be other circumstances where there are people who don't have symptoms, say if they're a cellmate or exposed, it may be sometimes that they would be testing them. All this is decided on an inmate by inmate basis to try to contain the spread within the facility.
Okay, thank you.
Thank you, Jason. We're going to go to Perla Lara with Impacto. Perla? Perla, you just have to unmute yourself there.
Yes, I'm sorry. Can you hear me?
Yes.
Okay. I have 2 questions. La primera es si han detectado alguna área de Filadelfia o algún sector específico de la población según edades que no esté respetando este encierro en casa. Si hay realmente un target para parar a la gente y que regrese a la casa.
¿Y te refieres al área geográfica y al rango
de la ciudad?
Exacto. My first question is if there has been a detection of an area within the city or a specific range within the population age-wise that is respecting the order to stay at home.
We don't have any way of measuring that, neighborhood by neighborhood. People can drive around and see themselves, but there's no measurement to that. I can say that citywide, we have done a survey, and the large majority of people are following our recommendations about staying at home and only going out for essential errands. A small percentage aren't, and we encourage those who aren't to follow the recommendations.
No hay una manera de hacer una medida exacta de esto. Obviamente, si se va anecdóticamente de barrio a barrio, se puede notar que hay gente que está afuera, pero nosotros sí hicimos un sondeo a lo largo de la ciudad y lo que encontramos es que la mayoría de personas está observando la orden de quedarse en casa y salir solamente para hacer los mandados y las compras necesarias.
La segunda cuestión es sobre lo que se publicó ayer o se hizo más viral de la decisión del gobierno de Donald Trump respecto a que los ciudadanos americanos que estén casados con personas que, aún habiendo pagado sus impuestos con el ITIN number, pero que no tienen un Social Security number, estos ciudadanos americanos no van a recibir esos $1,200. ¿Cuál es la postura del alcalde y si hay alguna forma de aliviar a estos ciudadanos estadounidenses que están siendo penalizados por estar casados con inmigrantes que no tienen el Social Security?
This is a question for the mayor. Mayor, there was published reports yesterday that became viral in regards to the announcement made by President Trump that those people married to U.S. citizens who do not have Social Security numbers but have paid taxes through the IT number would not be eligible to receive the $1,200 checks as a result of this crisis. And I would like to know what your position is about it and if there's any way to offer relief to those U.S. citizens whose spouses are not able to qualify to get this relief checks because they don't possess a Social Security number.
My belief is if you're paying taxes, you should be eligible for the stipend. Obviously, the president seemingly daily or at least weekly comes out with some pronouncement that is intended to incite the public and play to his ever dwindling base of supporters. We do not, as a city, have the capacity or the dollars available to supplement or supplant that payment. And what I would suggest doing, and we can also do it, is to talk to our Philadelphia and Pennsylvania delegations to see if there's something that can be done to correct that. But he is insistent on trying to be mean-spirited and divisive at every turn. I can't speak for him, but we can begin to investigate what might be able to be done in one of the next rounds of help coming from the federal government.
Bueno, yo quiero decir que me parece a mí inicialmente de que toda persona que paga impuestos y los tributa debiera poder recibir este estipendio. Nosotros sabemos que diariamente y semanalmente hay pronunciamientos que vienen del presidente Trump que son incitatorios para tratar de elevar el apoyo entre sus masas, que cada vez son menores, de gente que lo apoya a él. Y obviamente también queremos que quede claro que la ciudad no cuenta con los medios financieros para poder ofrecer un apoyo en este sentido, pero por lo tanto les pedimos a la gente que contacten a sus legisladores, tantos los de Filadelfia y los de Pensilvania, para que puedan ejercer presión de manera de que se pueda recorrer a mayores recursos. Estos comentarios que vienen desde Washington son siempre divisorios y tienen una intención mezquina, y nosotros lo que queremos hacer es invertir en la gente para que puedan desarrollar sus destrezas y puedan mejorar siempre.
Perla, did you have anything else? I think you just unmuted yourself.
Yes, I'm sorry.
Okay.
Can you hear me? Yes. I just want to be specific, like, si puedes mencionar que específicamente a los que no van a recibir estos $1,200 son ciudadanos americanos que tienen su Social Security number, pero que como están casados con una persona inmigrante que no tiene Social Security number, les están quitando ese derecho de $1,200, no solamente a su esposo que no tiene el Social Security number, sino a ellos mismos que son ciudadanos americanos que hicieron sus impuestos y que calificarían en caso de que no tuvieran un esposo que no tiene Social Security number. No sé si eso es claro.
Lo que estás haciendo es una pregunta, una observación.
Una observación y pregunta, porque esos son ciudadanos, o sea, yo entiendo que tal vez ellos no tienen los recursos para los indocumentados o los que han trabajado con el ITIN number, pero en este caso estoy preguntando sobre los ciudadanos estadounidenses que dejaron de recibir estos $1,200 solo por el hecho de estar casados con una persona que no tiene el Social Security number.
This is an observation and a question, and I'm making it clear that I'm referring specifically to U.S. citizens who do have a social security number and they're married to immigrants who do not and have an IT number and they have paid taxes, that they are being penalized, U.S. citizens, through their spouses by not being eligible to get this $1,200 checks. I would like to know what you think about that.
I think it's terrible, and I think it should be reversed. If they're paying taxes, they should be eligible for whatever every other taxpayer is getting. But with so many issues relative to immigration, mayors do not have the capacity to change the president's mind or to pass amended federal legislation. All we can do is advocate and lobby for this unfairness to be corrected.
Pienso que eso es algo terrible y debiera revertirse porque cualquier persona que paga los impuestos debiera ser elegible para recibir esta ayuda. Pero nosotros también consideramos que como alcaldes tenemos recursos y medios muy limitados de acción. Nosotros podemos tratar de hacer que la gente haga lo correcto, pero nosotros no podemos pasar legislación ni podemos pasar por encima de lo que están haciendo en Washington.
Gracias.
Thank you.
Thank you, Perla. We're going to go to Pat Loeb at KYW, and this is our last call for questions. Pat?
I just wondered if there was an update on the rapid test that you were running trials on a couple weeks ago.
I keep thinking we're going to have the validation done. The company acknowledged that they were having a problem with false negatives. And so they came out with instructions recently that said that after you take the swab, you should not put it into the liquid we ordinarily put it into, which is called transport media, and sending it before the test is done. But instead, that swab needs to go directly into the machine. And that means that the test of the machine can only be done at the site where you're collecting the sample. And so that means there's an extra step involved for us to do this parallel testing to see how accurate the test is. So we're still working on that. We don't have an answer to that yet. We do have some of these machines, and we are looking to where we can deploy them. We do believe that if this machine gives a positive result, that person is positive. That person has the virus in their system. If it gets a negative result, we don't know how to interpret it yet until we do this study.
Okay. And for first responders who have symptoms and get tested, are they specifically getting tested at the city's testing center, or would they go through one of the health systems?
They can be tested at any number of centers, including the city's testing center, but not limited to that.
Thank you.
Thanks, Pat. We're going to go back to Denise Clay.
Wow. I heard him just die.
Yes. When we sit down and have these briefings during the week, we talk a lot about the people who have tested positive for the coronavirus. What about the people who have tested negative? Is that on the city's website, or do we know how many people have tested negative as opposed to who has tested positive?
It is on the city's website. Just look for it.
Okay.
Right there.
All right. Thank you.
Okay. Thank you, Denise. Seeing no further questions, we will conclude today's briefing, and we will resume Monday at 1 p.m. Thank you all.